it's pleura. If you're in the abdomen, it's peritoneum. You should be fine. But we tend not to, tag it as a specimen per se. And then if we flip over to the other side, it'll just be the other kidney right there. Yeah, and oftentimes there's fat. One of the structures they have you guys look for is the adrenal gland, which is this guy right here. You can always tell the adrenal gland because it always has this vein coursing right through it. So it's always going to be, they call this the superior and inferior pole of the kidney. It's usually just adjacent to the superior pole of the kidney, and then it always has this little vein coursing across it. And it's relatively small, sort of the size of a bean maybe.
Professor?
Yeah.
Do we have to know the greater and lesser for this one?
Yeah, so we'll talk more about it next week. But the bulk of what you're seeing is going to be the greater omentum. But there's also a connection between the stomach and the liver, which is called the lesser omentum. This guy had cat food. Oh, and worms.
Jeez.
This guy had parasites.
Worms?
Yeah.
Why is it so hard like that?
It's
dead?
preserved. Oh, yeah. Yeah, I mean, it's embalmed just like the rest. But, no, it looks like a roundworm, actually. The tapeworms tend to be segmented. So that's probably like a whipworm or something like that. But it's real common in these guys.
Can I ask you something? It's
Yeah.
probably a silly question, but you know how they say cats eat rats and stuff? How does it appear inside of them?
You'll see loose bones and things like that. It would depend on how well digested it was, but oftentimes you'll see hair and bones are what's left over after they eat an animal.
Would you be able to identify that it's a rat?
Potentially. It would be hard for a cat this size to eat a rat whole, because an average rat is probably that big. But certainly mice are pieces of a rat. You'd be able to identify. But yeah, usually the hair and the bones aren't really digestible, but almost everything else is. And I don't think I've ever found a mouse or a rat in one of these guys. The one in the other class is filled. It was eating a lot of grass and stuff. It was just filled with plant matter. Usually you just see cat food.
Can you say his three names one more time?
Yeah, so this is going to be the duodenum, which is the first segment. The bulk of this curled structure is going to be the jejunum, which is the middle segment. And then the final segment is going to be the ileum, which is right there. But yeah, so this main portion is called the greater omentum. The stomach itself has sort of two curved surfaces on it. One's called the greater curvature right here, and one's called the lesser curvature.
Which is?
It's this little curve right there. The greater omentum comes off of the greater curvature of the stomach. The lesser omentum comes off the lesser curvature of the stomach and just connects to the liver. It's sort of hard to see because even though it's the same material, there's so much less of it, and it's so easily torn away. Like just this bit, some of this is all lesser omentum up in there. Yeah, and next class I'm going to talk about it because they talk about some ligaments and things like that. They'll subdivide the greater omentum into structures called ligaments based on what they're connecting. So there's like a gastrosplenic ligament, which is the portion of the greater omentum between the stomach and the spleen. But it's really confusing because, we've learned ligaments are heavy, dense connective tissue structures connecting bone to bone. This has nothing to do with sort of a traditional ligament, but they still call it a ligament anyways, just to make it even more confusing. So there's the gastrosplenic ligament. There's what they call the gastroduodenal ligament, which is going from the stomach to the duodenum. But they're really just regions of the greater omentum that are connecting different structures. Sometimes you'll see the lesser omentum called the gastrohepatic ligament because it's connecting the stomach to the liver. So if you see that hep term or hepatic, it's referring to the liver. The gastro term or gastric is referring to the stomach. The splenic term is referring to the spleen, yeah.
What is this little thing here?
So it's one of the lobes of the liver. It's probably the caudate lobe wrapping around. So yeah, the last lobe of the liver in the cat's called the caudate lobe, and it actually comes against the right kidney.
Is that needed to know?
No,
Okay.
no, it's just sort of useless information. They call this area the renal fossa, though, but yeah, it actually has this little cutout to accommodate the kidney. But like I said, as long as you recognize the liver as a whole, that's all. Okay. So this is all spleen right there.
This one too?
Yep. Yeah.
That whole
So if
thing
you
is
pull out this whole thing is spleen right here. They tend to be more of a darker sort of blue purple color compared to the liver. The liver in a normal animal is a real dark brown, sort of a reddish brown. Usually with these guys, it's sort of this pale yellow or pale brown color. But the spleen tends to stay darker than the liver in these embalmed specimens.
This is the gallbladder, right?
No, that's the
No.
adrenal gland. So gallbladder is always going to be nestled in between the lobes of the liver. And always
that's
has
right,
that
that's
green
what's-
color, yeah.
And for the male reproduction.
What's that? Okay, I'll be there in just 1
And we
minute.
need to know this area here too?
The only thing they have you do is just the basic reproductive organs. So the male, most of the equipment's right there. For the female, we have some intact females, so you'd be looking for the uterus and the uterine horns up in this region.
Okay.
Okay.
Sounds good.
Thank
Thank
you.
you.
Yeah, are you gonna post that anywhere?